My name is Kaylin. My pronouns are they, them, and I'm network manager of the Greater East St. Louis Early Learning Partnership. I, again, am so excited to welcome you to our fall gathering this year. We know it's been a year with a lot of successes. And, an example of that is Governor Pritzker's announcement about a unified early learning agency. We also know there have been a lot of challenges, like the ongoing violence within the United States and overseas in Gaza and Sudan. This year's topic of well-being in the early years is meant to recognize that all of these events impact us, as many others do, so that we can build strong, safe environments for East St. Louis's youngest children. Don't get me wrong, I'm not under any illusions this event is going to fix everything, but we do hope it can be one more space where we're sharing information, strategies, and support that get us closer to that vision. We welcome you to be in community, and we're so grateful, seriously, so grateful, y'all, for all that you do with and for young children. Thank you so much for joining. Our agenda today is as follows. We're going to move into a few ground rules just to center us in the conversation. We'll talk for just a few minutes about what ELP has been doing this year. And we want to highlight with two partner agencies, SIHF and Erickson Institute, who are going to present on a couple of reports that have come out over the past couple of months. And then we'll end with celebration. So we're going to recognize the Brenda Crisp Award nominees and the winner for this year. For our ground rules, we are going to use Crossroads Anti-Racism Organization and Training Guidelines. These are basically recognizing that conversations on topics like mental health are difficult and they don't always guarantee safety. But they also recognize that we can work together to create space where there is that mutual support. And so that's the idea of courageous conversations. And there are a couple of components that I want to lift up for today. The first is inherent worth and dignity. And so we want to make sure that as we're sharing our experiences, we're honoring every human that's in those stories. And one way we can do that is by making sure we're speaking from our own experiences and not telling stories that aren't ours to tell. This is especially important because we are recording and we're going to share it out after. So just make sure we're talking from I statements today. The second is to embrace ambiguity. And if you're anything like me, this one's really hard. You really want today to be wrapped up and have lots of clear actions and solutions. And we are going to provide some of those for you, but we also recognize that we're not going to be able to fully address all those topics. The ambiguity, though, shows us where there's work to be done, and I would encourage us to think about it providing space for imagining a world beyond what we're experiencing now, one that's more equitable, one where thriving is happening. And so can everyone either go to your reactions or to the chat and give me a thumbs up or a yes that you agree to these ground rules today? Great, we have lots there. Thank you all so much. So let's jump into some of our updates. And I want to start by grounding all of us in ELP's mission and vision. So basically, the long and short of it is that we want children in Cahokia Heights, East St. Louis, Fairmont City, and Washington Park to start early so they can finish strong. And as everyone here knows and engages with, there are a lot of ways that we can make this happen, but ELP really believes that being connected and participating in early learning programs and services is one key way to do that. We also recognize that there are a lot of barriers to that path, from staffing to fit with families. And so we offer a lot of informal opportunities for supporting early development as well. I want to name, before we get too far into ELP's work, that I am presenting on some of this information today. I am absolutely not the only person doing the work. We have, first and foremost, an amazing team of family liaisons: Gwen Brown, Ruth Calvillo, Danielle McGill, and Letty Hicks, many of whom have been in the work for way longer than I have and will continue doing the work with me and with us. We also have lots of work groups, which many of you are a part of, and our executive committee. So this work is a collaborative effort. The numbers and the stories I'm sharing are all representative of that happening in a collaborative space. So there are basically three main ways that we're seeking to accomplish our vision: family engagement and leadership, community education, and cross-program initiatives. And so you can see over the past year, we've had lots of hours of participation and contribution, over 250 hours in cafes, 320 hours in professional development, and over 1,000 from staff that goes to creating shared policy and practice. So lots of work happening here. And these numbers on the screen aren't even reflecting all of the amount of time and energy and resources that goes into preparing for these things. So to date, we've had over 4,000 contacts through one-on-ones, canvassing, and other outreach, which has led to us building a network of over 650 families, providers, and advocates who attend these events, develop shared strategies, and advocate for young children. So what is that looking like on the ground and like getting in the weeds of it? The easiest way to really think about that is to look at the different initiatives we do every year. So I'm going to start basically by breaking each of those down and talking a little bit about our accomplishments in each. So the first one is Week of the Young Child. And for those of you who may be new, this is basically an annual celebration of young children and the adults who support them. This year, we focused on strengthening social emotional supports for young children, something very connected with our topic today on mental health, right? And we had a week-long calendar of events that supported our ability to do so. So on the left-hand side here, you can see a breakdown of our attendees at 3 different events: music, mindfulness, lunch and learn, storytelling workshop, and then family and community cafes. And on the right, you'll see that we made over 100 deliveries of social emotional development kits in partnership with PBS is drawn in as well. The next highlight I want to provide is around kindergarten transitions. And so as many of you probably remember, we've done a ton of planning to create shared strategy for improving transitions across District 189. And one of the things that continued to come up, I mean it y'all, over and over again, was we don't know how children and families feel. And so we have worked to implement some ongoing feedback opportunities for families and children so that we really know what the experience is, and we're ensuring that their feedback and recommendations are what drive sort of practice and policy change. And so this year we worked with Eastside Alliance Shantae Ford, whose focus is on youth voice and leadership, to actually build on a survey that we offered to do an in-class activity that you see here on the screen. And this was at Officer Elementary. We basically went and asked exactly the questions we didn't have answers to, right? We talked to children there and we said, how do you feel about your classroom? What about the school overall? What about moving from your home or Head Start or childcare or pre-K to kindergarten? And as you might imagine, the conversation was amazing. Children were super engaged. We partnered with lots of amazing staff at Officer to make this happen. And as a result, we have tons of results that are way too expansive to list in the presentation. But I will tell you this. These conversations were a great reminder that big and small actions can support their comfort and success, right? And so we're in the middle of our 3rd year of implementing this process, and we're excited to share that we're actually working with the district to set up an action plan development as a result of the findings from this. So again, going back to those who are most impacted are the ones making decisions. How are we co-creating a plan that works best for children and families? The third key activity I want to talk about is Ready, Set, Enroll. And so this is that campaign that many of you are involved in that happens every summer that has the goal of increasing enrollment in early learning. There was something new this year that I really want to highlight and focus on, though, and that is an expansion into Fairmont City. Over the last several years, we continue to sort of hit this wall where we say, oh, we really need to be doing work in Fairmont City. We know that those resources would be really supporting early development in Spanish-speaking homes. And this year, because of investment from birth to 5, we were able to do that exactly. And so on this slide, you see a breakdown of sort of what outreach to English-speaking families looks like, but also Spanish-speaking families. And so during this year's events, liaisons connected with nearly 2,000 individuals to talk about the importance of early learning, the process for enrolling, and more. Staff, again, these are the staff who, like I highlighted a minute ago, Gwen, Letty, Danielle, Ruth, offered family cafes on lots of topics, which reached over 130 participants. And y'all, this is great for a really short week. You know, it's like a 6 to 8 week period of time. Reaching that many families it demonstrates the amount of work and energy and commitment that these folks have. You can see on the right that we have a reflection from an attendee at one of the cafes, and they basically say, topics that were discussed gave me a chance to reflect back and make sure I'm continuing on the path I've chosen. And that's exactly what we're trying to get at with these cafes, right? Shared learning, connection, reflection, and affirmation. And so through these conversations, the next step is often referring and connecting to formal programs and services. And this year we had 25 English referrals and 4 Spanish referrals. Lastly, I just want to touch briefly on our advocacy efforts. These are ongoing within ELP, but we haven't done a super great job at sharing them, so that's what we're trying to do today. There are 3 main areas that we really focus on right now: state council membership, public awareness, and media and legislative advocacy. And so 2 highlights from these activities are the St. Louis on the Air episode. You can see on the left here, our co-chair Amy Washington Hart shared about the challenges early learning providers face with the end of federal COVID investments in early learning. For those of you who are a provider, you know what this is. It's really impacting our ability to support our young children. If you haven't already listened and maybe are less familiar with the topic, definitely please go online and check it out. I will absolutely include the link in the follow-up email. The second thing I want to highlight is the staff advocacy for the Illinois budget allocations into home visiting. And so here we partnered with Raising Illinois and basically advocated for an increase of $75 million in investments in home visiting to support children 0 to 3 better and more consistently. And so that was a lot in a short amount of time. But what I'm hoping is that this is going to give you just a little bit of context on the varied work that we do. Hopefully it inspires you to take action somewhere, whether that's with us or with another organization or individually. We are going to put together a more comprehensive report and summary so that you can get into even more details if you're interested. And so keep an eye out for that. Everybody who's on our mailing list will get emails when that's released. But for now, let's turn it over to our agency partners. We're going to start with Tia Britton from SIHF, who's going to be talking about birthing parent mortality and morbidity. Tia, can I turn it over to you?
Yes, thank you so much. Thank you guys for having me. I hope everybody is having a great morning so far. As she stated, my name is Tia Britton. I'm one of the program managers for our Healthy Start program at SIHF Healthcare. So the Healthy Start program is basically a federally funded program that provides support to moms, dads, and babies throughout pregnancy and up until the baby is 18 months. So we just make sure they're connected to the services that they need to have a healthy baby and healthy pregnancy. And so I'll speak a little bit about the highlights regarding the Illinois Maternity Morbidity and Mortality Report that IDPH issued in October. So on your screen, what you see is the continuum of maternal health outcomes. And so it ranges from minor complications to maternal death. The maternal morbidity refers to the short and long-term health problems that are related to childbirth or pregnancy, and it can be minor or it can be severe morbidities. And then maternal mortality is just maternal death, and it refers to the death of a woman during pregnancy or within 1 year of any pregnancy outcome. So it's most common for a woman to experience a healthy pregnancy without any complications, but minor morbidities and complications are somewhat common, and more severe complications are rare. And maternal death is really rare. It's usually only about 0.1% of pregnant or postpartum women who experience it. And we would like for that not to happen at all. And so I'll go over to the next screen, which talks about the maternal mortality. Oh, no, you can go back. I'm sorry. The maternal mortality. So maternal mortality or maternal death, like I stated, is the death within 1 year of pregnancy or during pregnancy. Pregnancy-related deaths are a subset of pregnancy-associated deaths, so it's important to identify all of the pregnancy-associated deaths so that we can track and understand maternal mortality. And so IDPH, they have 2 maternal mortality review committees that review the deaths closely to determine the causes of death and determine whether or not it was pregnancy related. They review the pregnancy associated death from medical conditions that potentially relate to pregnancy and pregnancy associated deaths due to homicide, suicide, unintentional drug overdose, or other drug related issues. We'll go to the next slide. Okay. And so this figure shows the importance of tracking maternal deaths to 1 year postpartum. As you can see, approximately 1/3 of pregnancy-related deaths occurred 2 or more months after pregnancy. So the timing of deaths vary depending on the type of pregnancy-related deaths. So pregnancy-related deaths from medical causes are more likely to occur within the first 2 months postpartum, so after they deliver, while pregnancy-related deaths from mental conditions and substance use disorder were most likely to occur 2 or more months postpartum. Go to the next slide. And so I'm sure you guys have heard that African-American women are more likely to die from pregnancy-related causes. In fact, they're 3 to 4 times more likely to die in compared to Caucasian women. The most common underlying causes of pregnancy-related deaths were substance use disorders, cardiac and coronary conditions, pre-existing chronic medical conditions such as sepsis, mental health conditions that resulted in suicide. So to compare the factors that influence the different causes of deaths, the deaths were placed into 2 groups: the mental health conditions and substance use disorders, and then the second group was all medical conditions. 58% of the pregnancy-related deaths were caused by medical conditions, and about 40% were caused by mental health conditions and substance use disorders. Go to the next slide. And so deaths are considered preventable if a reasonable change to like their medical provider, the location that they're receiving care from, the community, or any type of systematic factors can be changed to help prevent the death. It's not just limited to clinical factors, but it also considers the social and community factors that are influencing the death. So an example could be, say, for instance, a hospital, they didn't have enough blood available when a mom who recently delivered had a hemorrhage. And so if they had that blood available, it could have increased her chance of not passing away. And so it's just like specific protocol changes that could have altered the outcome. And then the preventability of pregnancy-related deaths are similar across all ethnic groups. However, 4 out of 5 pregnancy-related deaths listed, as you see on this slide, speaks of potentially preventable pregnancy-related deaths due specifically to medical conditions. You can go to the next slide. So this just lists some of the causes that could be attributed to it. So insufficient care can also be the improvement of the quality of care services that the pregnant woman received during her pregnancy and then during her postpartum period. It can vastly impact their health outcomes. They found that maternal deaths highlight the need for better communications between the patient and their medical provider, as well as an improvement in the patient education when patients interact with the healthcare system. We must improve all of the quality of care at all healthcare levels, so the providers, the hospitals, the different healthcare systems, so that we can improve health outcomes. Poor coordination of care. What the report noted was that we need to improve the delivery of care from women who receive multiple providers during their pregnancy period and the systems of care that they interact with. The report found that a lot of women were referred to specialists when they did not have any support in getting an appointment. So the burden of follow-up was left onto the woman, which may have resulted in them not, getting a follow-up appointment or making that initial appointment with the specialist. Some providers, some of the women had multiple providers and they were not communicating with one another, which could affect her care as well. And so having social workers, case managers, and other community-based supportive programs to help women to navigate these systems would be beneficial. Lack of access or limited access is also a barrier. Women with chronic conditions, including mental health conditions and substance use disorder, they need ongoing attentive care throughout their pregnancy to make sure that they have a healthy outcome. And so women, they face barriers to finding specialty care, especially in rural areas, because the specialists are usually in urban areas or more populated areas. And so with them having a lack of providers in the area, they'll have to travel longer distances to get these services, which can serve as a barrier if they don't have adequate transportation. And it can also be discouraging for them to, want to travel that far as well. Then lack of community awareness. What the report noted was that this is really common in regards to the postpartum warning signs. So the postpartum care is that year after you give birth. It's commonly known as the fourth trimester. We've seen in the media how this has been highlighted nationally. So you may have heard of documentaries such as Aftershock or Toxic. I think Aftershock is on Hulu, and it just chronicles the life of two dads who spouses experienced a pregnancy-related death. And so they're just telling their story and, highlighting the inadequacies that were in the medical system that led up to those deaths. And so I think we do a good job nationally, but we need to do better locally, so that we can just make sure that our families and our communities have the resources to know about the services that are available, as well as the warning signs of severe pregnancy complications. The report showed that many women delay seeking medical attention for severe pregnancy complications because they don't know the warning signs. So they're not being educated. So we have to make sure that we not educate just the mom, but also her support system, so that if they notice that she's experiencing any of those symptoms, they'll know how to act and help to advocate for her. And you can go to the next slide. And this slide, it basically shows the 3 different types of chronic diseases that are common, and how they have increased from 2020 to 2020. From 2010 to 2020. More women experienced more than one of these chronic conditions, so it wasn't just exclusive to one particular condition. Maternal mortality increased 33%. Maternal obesity increased 33% from 2010 to 2020. Hypertension increased 103%, and then diabetes increased 68%. And it's very, very important that the women receive ongoing medical attention for these, because they can cause complications during pregnancy and delivery that can result in pregnancy loss, birth defects, stillbirth, preeclampsia. It can also be life-threatening to the mom as well if it's not treated in a particular time frame. And some of the effects of these complications can last a lifetime. Go to the next slide. And so this one kind of focuses on the mental health recorded by the delivery hospitals from 2018 to 2020. There were approximately 8.4% of live births that had a mental health condition recorded by the delivering hospital. They were mostly recorded by the hospitals for women who were American Indian, who lived in counties outside of the Chicago area. And then, as the figure shows, majority of the delivery hospitals for resident counties in central Illinois recorded the maternal and mental health conditions. So they did a better job than the Chicagoland area or even within our area. Fulton County had the highest rate with 31.4%, and then there were 19 counties that had 16% or more recorded, and this was like in the Champaign, Springfield area. You can go to the next slide. And so this basically shows that during 2018 to 2020, there were 1,151 women each year that experienced a severe maternal morbidity during their delivery, which equated out to about 1 case per 115 deliveries. So when you speak of severe maternal morbidity, this can include severe bleeding, kidney failure, breathing issues. Those were the most common categories. The severe maternal morbidity varied significantly by race, age, education level, region, or residence and insurance type. It was most common in women who were Black, 40 years and older, had Medicaid insurance, or who lived in the Chicago area. It was also more common among women who did not receive prenatal care or received inadequate prenatal care. They had severe obesity, hypertension, or diabetes, and they had mental health conditions or substance use disorders. So it just basically shows that the severe maternal morbidity across Illinois varied, but it didn't have a clear geographical pattern. And you can go to the next slide. So how do we address this? There's a ton of ways that we can do it. One way that our program does it is through, well, we start off when women enroll in our program, they are partnered with the case manager. So they've received one-on-one case management. The dads, if they come into the program with mom as well, they are partnered with our male involvement coordinator, and they just kind of work together to make sure that mom and dad are on the same page throughout the pregnancy, that dad is understanding how to support and advocate for mom, that mom is understanding what it is that she's going through and how to advocate for herself as well. We also offer free education, prenatal and parenting classes, and we have medical providers and a community doula that teaches those classes. We go over the warning signs for pregnancy. When you need to go to the ER, we teach them how to advocate for themselves, just the basic information that they need to have a healthy pregnancy, how to eat right, how to manage stress. We get them connected to any resources that they need, whether it's housing, employment, mental health services, or behavioral health services, things of that nature. So we just want them to understand that, even if you've had prior pregnancies, every pregnancy is different. So it's important that you make sure that you're taking your prenatal vitamins, that you're going to your prenatal appointments, and that, you're doing everything that you can to stay healthy and to keep your baby healthy. We do have our case managers do follow up with our moms after they deliver. So they meet with them, just to make sure that, they are going to their postpartum visits, that they are getting birth control so that they can space their pregnancies within that 18-month window, and that dad is understanding how to help mom through this transition period. And then mom is also understanding how dad is dealing with everything as well, because he's not going through it physically, but mentally, he's adjusting, with the responsibility of having to care for a family as well. And then BJC Memorial Hospital in Shiloh, they have a emergency room within their maternity unit. So if a mom is pregnant, or if she's, postpartum, she's just recently delivered, instead of going to ER at a regular hospital, they can go specifically there. They have a hospitalist on staff 24 hours that will be able to meet them. What I love about the concept of this is that it helps to decrease the waiting time that they will wait in a normal waiting room, so they can be seen faster. And this is great because, anything can happen if you're having a pregnancy complication. It can result in a stillbirth. It can result in a miscarriage. It could result in, something traumatic for the mom. So it's very important that we, start to have these things in place so that we can help them. And then we also have one of our doulas. She goes over the Black Birthing Bill of Rights for them to basically understand what their rights are as while they're pregnant, like what they have a right to. They have a right to have their voices heard. They have a right to have, a healthy pregnancy. It's just certain things that we want to empower them with, to help them to know that, like, you do have a right to equitable care. And don't be afraid, to talk with your provider. Don't be afraid to get a second opinion. If you're not sure, don't be afraid to ask questions, because sometimes moms feel a little afraid to, ask. They might feel intimidated, but it's important to ask questions so that you can kind of understand what the doctor is saying, what that means for your health, and how you can incorporate what they're telling you to do. And then all of our classes are offered in both English and Spanish. And then we have 2 bilingual case managers on staff that assist our moms as well. You can go to the next slide. And so some calls to action is to advocate for expanded home visiting programs, encourage healthcare providers and teams to offer training and policies that address implicit bias, racism, and stigma, support community-based organizations that are building awareness, and encourage friends and families to participate, to have their loved ones to participate not just in the annual well visits, but in their prenatal visits. If we can get their team to understand, what mom is going through and why it's important that she goes to prenatal care, why it's important that she has a postpartum visit, how they can support her in those processes, I think we will have better outcomes in doing so. Go to the next slide. And so the Illinois Task Force on Infant and Maternity Mortality is something that me and a couple of coworkers are a part of. And so what we basically want to do is learn about the experiences of Black mothers during pregnancy and delivery. So we've had 3 listening sessions within the past year and a half. We've had one in Chicago, one down here in Southern Illinois, and one in the Rockford area. And so this is our last listening session, and it's just going to be via Zoom. It's for anyone in the state of Illinois. I always encourage our moms in our area to join in because we get a lot of representation from the Chicagoland area and we don't get a lot of representation here. And so if we don't get representation here, we can't have the change that we need. And so if you have any moms that are interested, they must have delivered within the past 2 years in the state of Illinois and been pregnant while they were in Illinois. They must have, they have to deliver within the state of Illinois. They must have private insurance, and they must be within the middle income bracket. So this is a little bit different from what we have done in the past. Our groups in the past were moms who received Medicaid insurance. And so we were able to hear that feedback. And so we're doing it with private insurance this time to kind of see if there's a discrepancy in the care that both parties received. But if you do have moms that want to participate, I can type the email into the chat and they can just send us the email and we can get them registered for the event on November 29th. That is all I have. Does anyone have any questions? Thank you so much.
Great. Thank you so much, Tia. And everyone, please send her love in the chat and with emojis and reactions and everything. I know it's hard to get that energy up in a virtual setting, but yes, let's do that. They're doing amazing work. Amazing work. And so definitely reach out and we can get you connected with the work they're doing. For now, we are going to turn it over to Veronica Vidal, who is with the Erickson Institute. And she's going to be talking about infant and early childhood mental health consultation. If you all think about other questions that are coming up, please feel free to throw those in the chat. We'll compile them and we'll get answers out to you as a follow-up email to this. So Veronica, I am going to turn it over to you. Let me get this full screen.
All right. I'm on my phone, but video on my computer. So I hope everybody can hear me okay. Can I just get a quick thumbs up or visual? Yeah.
Yes.
Okay. Got it. All right. So thank you for having me. This is just a quick presentation on some findings that we did. It was an equity analysis for infant early childhood mental health consultation. It's a mouthful. It was a project that was commissioned by the Governor's Office of Early Childhood Development just before they closed their doors. So if we go to the next slide, I just want to give I just wanted to give our partners a shout out, the Illinois Early Childhood Asset Map at the University of Illinois Champaign-Urbana, and the Children's Advocate for Change, as well as a long list of organizations that helped us, it helped inform the project so that we made sure that we are on top of what is currently happening. So if we go to the next slide, I just want to provide a grounding of what infant early childhood mental health consultation is, because it is a very abstract term, I think, for a lot of folks. And so for short, you're going to hear me refer to it as mental health consultation or just consultation, just for the sake of brevity. So mental health consultation is a prevention-based support service for people who work with young children and their families. So essentially our early childhood workforce. This service pairs professionals working in the mental health space. This can be social workers, counselors, psychologists. It pairs professionals with early childhood staff to help them think through strategies on the best ways to strengthen the healthy social emotional development of children in the classroom, and to help do that early and before intervention is needed. And so while I know that there's probably some people on here who know what consultation is, I wanted to provide the definition because what we've learned in this project is that not everyone knows what it is and knows that it's available. So we move to the next slide. Just a quick, the purpose of this project was, one, to demonstrate the importance of mental health consultation for our early childhood workforce. We know that it's a service to them, but families also indirectly benefit. Again, it helps our early childhood workforce incorporate some strategies to address behavior and mood changes that they see in children in the classroom. And the second is to understand the equitable access to mental health consultation in Illinois. So if we move to the next slide, we'll get started with who is consultation serving. And then the next slide is, again, our early childhood workforce. This is teachers, assistants, staff, home visitors, and administrators. Again, people who are in direct service to children and families. So the next slide. So to understand how our early childhood workforce benefits from mental health consultation, we at Erickson conducted a couple of focus groups with early childhood professionals who received these services. And what they told us was that consultation, one, provided a safe space for staff to address implicit biases, which helped keep them accountable. Two, it assisted staff in increasing their cultural awareness by reminding them to maintain an open-minded approach and respect the differences of how each family functions and processes situations. And lastly, it reminded staff to prioritize the unique needs of each individual family who may not have like the same lived experience as others within their community. So the bottom line is treat families based on how they want to be treated, not on how we think they need to be treated or how we've treated other families, but to focus on their unique needs. And these are some of the quotes that really stress the importance of mental health consultation that came from both consultants who provide these services, but our early childhood providers as well. So one consultant said, the behaviors are telling me the child is stressed, overwhelmed, etc., but this isn't their only environment. So it's important to try to put the pieces together. So again, when children have changes in behavior or mood in the classroom, it's coming from somewhere. It's not necessarily reactionary to the classroom, but there could be a number of factors that are attributed to the changes in their behavior. One early childhood professional said, for a lot of my families in Chicago, health and safety are an issue. Another consultant said children coming in from some type of trauma environment is a common theme I see. And another early childhood professional said, thank you so much. There's so much to have to deal with that comes along with trauma and other issues that children and families are facing. And so that was another big theme that we saw from the early childhood workforce is not only are they contending with helping children and families work through traumatic situations, but sometimes that also triggers secondhand trauma in early childhood professionals themselves. And so consultants, in addition to helping them provide some strategies for the classroom, have also needed to provide some self-care plans for early childhood professionals themselves. And if we move to the next slide, access points to consultation. I wanted to take a quick look at the various programs. Here you see we have 3 agencies that fund a number of programs offering consultation. Most of these programs are direct service programs providing services to children and families, but I want to make a special note here because Caregiver Connections stands apart because it's an entity where their sole service is to provide free mental health consultation to childcare providers. So remember their name. If you are an early childhood provider and you're not receiving consultation, they are someone to look into because they offer those services for free. But if you know that your program, if you're an early childhood provider and you know that your program falls under any of these programs listed here and you haven't had mental health consultation services offered, you should ask about that service. In some cases, I will say availability is really dependent on funding, which can fluctuate, and I'll break this down in the next slide. Of these programs, we can go to the next slide. Of these programs, 5 of them require consultation because they receive federal funding or have received it in the past. So, for example, the availability of mental health consultation in the Head Start programs may be more consistent than, say, Prevention Initiative because federal funding requires them to provide this service. The other programs that build in consultation as a requirement are home visiting, early intervention, and preschool for all expansion. And in the next slide, I just wanted to give a quick look at where these services are offered just on a map. These are approximate locations of where consultation programs are in the southern region. We can only map program sites or administrative offices where data is available, but this gives us an idea of the different points of access. And if we see there, we can kind of see what, there is like a little bit of a cluster near the greater East St. Louis area. Obviously not shown here is home visiting because those services take place in people's homes. And this next one shows what it looks like for the whole state. I have here the number of consultants we know are registered and working in Illinois. There are more, but these are the ones who are registered, 152. So imagine 152 consultants spread across the state. It does obviously point to we need more consultants to support the workforce. And in this next slide, I'm going to give you just an idea of how stretched our consultants are. By looking at the numbers, we have 152 consultants who are working in Illinois. We have more than 60,000 professionals working in early childhood. And then we have like 887,000 children ages 5 and under who may or may not be in programs. But if we're doing some simple math here, dividing the number of early childhood professionals by the number of consultants, that would mean that to ensure everybody in the state is receiving this important service, one consultant would have to provide services to 396 people. And so it's, and then if we're looking at the diversity of our early childhood workforce and children in Illinois, the percentage of diverse consultants doesn't exactly match up. And we know that understanding that cultural context it's an important factor for deepening your connection with someone. This also plays a factor when we think about language and the diversity of languages that are spoken by our workforce and our families. I don't have it on this slide, but of the 152 consultants, only 17 indicated that they offer services in Spanish. So if we think about also the time it takes for a consultant to build trust with early childhood staff, and the number of consultations that are provided in the year, it's really just not manageable. I'm going to wrap up here. Everything we heard from the field boils down to the need to boost awareness within the early childhood field, including parents who are seeking guidance from our early childhood staff about mental health consultation. We talked to a couple of parents. We weren't able to do a full focus group on parents only because of privacy issues. But we did talk to two who wanted to contribute, and they said, knowing that our early childhood staff has this support service for them really did kind of, I think, not calm their nerves, but it reassured them that their child would be, helped for anything that they needed. The other things that we need to pay attention to is promoting consultation benefits to increase cultural awareness and reduce implicit bias in the early childhood workforce. One thing that came from consultants is we need a streamlined and centralized reporting. We need new technology and a centralized reporting system across programs. Let's see what happens with this new agency. And lastly, of course, we need to increase funding. So I'll end with kind of some things that you can do. For providers, again, ask your program administrator if your program is eligible for a consultant. If you are, there is a database to locate a consultant serving your county. I'm going to drop these links right after. If you're not connected to any of the programs offering consultation, contact Caregiver Connections. Again, they offer free consultation services to providers. And lastly, whether you're a parent, provider, supporter of early childhood, read more about how these services really help people who care for our children. And as Kaylin mentioned, there are opportunities to get involved and advocate, whether it's through the ELP or other organizations. I didn't have time to go into it, but when we talked to early childhood providers, they did talk about like the deep mental health strain that they experience in working with children and families, and really uplifted consultation as being an important service to them. So and making a substantial difference in being able to manage. So I will wrap up, but I'm going to drop these links in the chat for you all. That was all that I had.
Great. Thank you so much. And again, let's send love to Veronica for being here today. Give some energy. If you have questions, please do put them in the chat and we will get them answered. But as she said, there's an amazing report that's out, resources for everyone to dive in more if they would like to. This has been amazing to get updates on all this information. And I'm sure you all are sort of like absorbing everything and thinking, okay, where are we going next? Well, we're going to celebrations, right? And so we are going to be talking about the Brenda Crisp Award nominees. Specifically, Gwen is going to do that. So I'm going to turn it over to Gwen and we're going to hear about this year's nominees and do a little celebration at the end of this event today. Gwen?
Hello, everyone, and welcome today. So I'm doing the presentation for the Brenda Crisp Award. We have 3 nominees for the award today. We're going to talk about why the award is what the award is. So Miss Brenda Crisp, she's the the former executive director of Unipress Kinder Cottage. And she's dedicated her life to nurturing the health and development of young children. This early childhood champion award honors her legacy of creating spaces where children and families are loved, cared for, and equipped for success. I just wanted to add to this, just give a little history of what the award, of Miss Brenda Crisp's work in this and how it came about. Miss Brenda, along with 2 other ladies, Miss Gloria and Trina Thompson, they came up with a partnership to try to help people who are in early learning. Miss Brenda, she continued to work, and this work started small until it was at a point to where it was just overcapacitated. They were reaching out to providers in the area, and there was a need for resources, and they needed more education on how to keep their businesses afloat to thrive, and also just to help educate them as well and help their families. Funding over the year has been contributed by United Way, Chassis, as well as the Victoria Foundation. And due to this funding, it has allowed the continuation of various trainings and securing resources and bringing child care professionals together. So a lot of early childhood professionals heard about this. They all got together, and the first time they would try to get trainings and they would be out of town. But when it was able to be brought here by Miss Chris, when she had her first meeting, it was like standing room only. Then they had the second meeting, standing room only. They had to go move that over to the Mary Brown Center, standing room only. Then they went to JJK, and just about every room was filled to capacity because there was a great need for this type of work. There were dignitaries, legislators, everyone just wanted to be involved in it. And and here we are today. So with this, we have this award, which honors an early childhood professional or a volunteer or an advocate within the greater East St. Louis area who embodies Ms. Brenda's nurturing spirit, commitment to quality, and relentless passion for improving child well-being. So one of our nominees is Ms. Tina Branch. And Ms. Tina Branch, her pronouns are she, her. She's the director of Rosie's Kids Christian Academy. Rosie Kids, the facility provides adequate care the Kingdom way, meeting the individual needs of the whole family on various levels by spiritual, mental, emotional, physical, and academic supports. One of the nominations, what was said about her, one of the things that she remembers speaking.
You muted yourself. Yeah.
Can you hear me?
Sure can.
Okay, sorry about that interruption. Said, I remember speaking life into a child that was feeling defeated with their schoolwork. She went above and beyond to show the student different strategies and concepts as a means to reach the child on his individual learning level. She even reached out to educators she knew to ask about tutoring for the child to help him succeed academically. And that's what it is. We're about trying to better all our children in any way that we can. So thank you, Ms. Tina Branch Williams. We also have Ms. Valerie Young. Her pronouns are she and her, and Ms. Valerie Young is a community leader in our city. Valerie is the commander of our local VFW Post 3480. Valerie is always a part of helping to clean up the community. It's called Empire 13 Boots to the Street. Valerie hosted a back to school event in Jones Park where her and her veteran group members gave away many school supplies to families this summer. So if you all receive school supplies, more than likely you receive them from Ms. Valerie Young. Some of the things that were said about Ms. Valerie is that she has been faithful with her community service to East St. Louis. Valerie has volunteered her time to help start the Tiny Children's Garden at 733 North Illinois Street. Valerie and her veteran post took time to collect and pass out loaded backpacks to small kids as well as older kids in order to help them in their mission on learning. So we salute you, Ms. Valerie Young. Next, we have Ms. Jerian Watson. Her pronouns are she and her. She's a teaching assistant at Vivian Adams Early Learning Center through District 189. Jerian is a teacher assistant at Vivian Adams Early Childhood Center. She is an entrepreneur, wife, and mother. She goes above and beyond her job. She supports the students, fellow staff members, and families with kindness and grace. And that's what it's all about. She is all about the children and doing what is in their best interest. That's what we look for. That's what this program is about, celebrating our children and our educators, trying to make sure that they have all that they need. One thing that was told about Jerian It said Jerian has been a staff of the month at Vivian Adams for her assistance in her previous classroom with a new teacher, helping set up the routines and keeping students on task. And that could be kind of difficult, but she did it and she does it. She is an amazing, she is amazing, I'm sorry, at parenting and family communications. She serves on several school committees to ensure Christmas and graduation programs are organized and that they run smoothly. We celebrate you, Jerian Watson. So now, drum roll, please. We have a winner out of the three. We have Tina Branch Williams, who is our winner of this prestigious Brenda Crisp Award. We thank you, Tina, and we want to know if you have anything that you would like to say.
I don't know that she was able to join unless she's under an iPhone.
Okay. Well, I know when I won, I was shocked and surprised. I'm sorry, I'm a recipient of this award, and I was shocked and surprised. Maybe she's shocked and surprised as well.
Hello, everybody. This is Brenda Crisp here. And if I may, for just a second or two, inject my few words. I am very, very shocked that this award, named after myself, continues each and every year. But I am so pleased and so honored to see the nominees each year. And I just want to thank each of the nominees for the work that they do, and especially thank Tina for receiving this year's award. This is, I mean, we do great work. We do great work, and we prove it each and every year. I'm just overjoyed. I'm really overjoyed, and I want to thank you. I want to thank also, while I'm here, Kayla and Gwen, both, for your organization. I was not able to attend the first part of the meeting because I was on another meeting, but I can't wait to go back and see the notes from it. But thank you all so much again from the bottom of my heart. I hope you all enjoy a beautiful, beautiful day. Tina, wherever you are, the rainbows are shining on you, dear. Continue your good work, as well as the other nominees. Continue your good work, because we still got work to do with our children. Thank you all. Bye-bye.
Thank you. Thank you, Ms. Chris.
Wow. I'm
Yeah.
super excited.
I was
I
ready
see
to
a
flip the
Tina
rotary up
John.
in here.
I see a Tina John. Is Tina John Tina Branch?
Hello. Did I just hear my name? Did I
We're
just hear
looking
my name?
we're looking for Tina Branch, but I didn't know if I see a Tina John in here. Is that Tina Branch
Okay.
or no?
Okay.
I don't think
My
so.
apologies. Okay, my apologies.
Well, thank you everyone for being here today. It has been great to host you and to be in a shared space with you. I think Miss Brenda said it best, like, we've got lots of work to do, and there is a lot of community here to do that work and to share in it together. And I'm not sure she's still on. I was going to say, Miss Brenda, your spirit and your passion and all of the foundation that you've set really continues to motivate the work today. So thank you so much. And everyone who's contributed over this year and over past years since the founding in 2009. We are here because of everyone's contributions. So we're going to leave it there. I know we're 5 minutes over, so we're going to leave it there. But thank you so much. We hope that we'll see you all in our future events. If you're registered for tonight's event or tomorrow night's event, we'll see you there. And I hope you all have a wonderful, wonderful rest of your day and your week.
Well, can
Thank
I add,
you.
Yeah.
I'm going to advocate for our parent cafes. Don't snooze and lose. You will enjoy yourself at our cafes. Just letting you know, we don't have enough time for our cafes, but we would love to see you there.
If you're not registered, don't worry. Just email me. I'm putting my email in the chat. We'll get you registered for it. But otherwise, thank you. And I hope y'all have a wonderful day.
Caitlin, register me